On this World Homeless Day, we're going to be talking to one of the top practitioners of mental health, and her name is Tasneem Raja. And she's been a mental health clinical psychologist expert for the past 30 years, and she's been working with the Tata Trust. Now she's associated with them for the past 14 years, and she has done some wonderful work under the organization that she has founded called Udaan. Udaan is a pioneering organization of sorts because it actually collaborates with the government, and it's an experimental sort of an organization because it deals with humanizing the conditions within the mental health institutions, and these are institutions primarily for the poor and the disenfranchised and the homeless. So she has a tremendous amount of experience, a tremendous amount of empathy that she brings on board, when she's doing this work. And she's one of the tallest leaders in this space, and we're really happy to have her. Apart from that, of course, she's also the member of the Maharashtra State Mental Health Authority. And in that, she is working with the government. And that's quite unique for somebody who's an activist, because most activists usually do not like to work with the government because of the fact that they find it controlling and restricting, and they find the processes a little too stifling for them. But she has a completely different way of looking at things, because she feels that if you have the government support, then you can actually go the last mile. So the entire Vidarbha region is something that she's empowering through her work. With 14 districts are the domain where she actually works from. Tasneem, you're a clinical psychologist, and you are studying for your PhD, and you just submitted your PhD papers in. So I think it'll be befitting for me to call you Dr. Tasneem in a few months. So congratulations on that. You've done some wonderful work with the mental health institutions in India through your organization Udaan, which is supposed to be a very, very experimental and pioneering organization, and very, very different from whatever else everybody else is doing. How's it different? And I'd like to know more about Udaan. Can you tell us more?
Okay. So thank you for inviting me. And so really, Udaan seeks to answer this question: that can we change the image of psychiatric institutions these institutions take care of very ill people, and a lot of them are really come from very disadvantaged backgrounds. So the effort of Udaan is to see if we can reform these psychiatric institutions to provide high quality care in a humane manner, restoring the dignity of the individual. So yes, Udaan is an experimental model which really seeks to do this path-breaking kind of model building.
And how do you go about it? What is the process that you use? I mean, how did you create Udaan?
So Udaan has come about from a lot of past work done by the Tata Trust in the field of mental health. And it draws from our prior experience of working across India. I mean, by its nature, philanthropy works with the disadvantaged segment of society. And through all the work that we did, Udaan is really a culmination of all that experience, and Tata Trust directly signed an MOU with the government of Maharashtra to bring about this whole experience into looking at how we could really reform a psychiatric hospital. What are the things that will go into it? And eventually, the most important question to be answered is, okay, if we do all of that, does it really make a difference to the person at the end of the story? And what is that real difference that it makes to the person, and what is the process of making that difference?
Wow. So I heard you say the government of Maharashtra. You're actually working with the government. Now, most activists that I know of are loath to work with the government because of the control and the interference, and they find it too bureaucratic, and they find it too cumbersome to work with the government. In fact, many of them are actually confronting the government and questioning the government on various archaic laws and other things that are happening. So how's that experience, and how is it working out for you? I know that Tata Trust, the organization that you are working with, works very closely hand in hand with the government on various philanthropic issues and various philanthropic events. But how's this working out for you? Are you comfortable with that arrangement of kind of having to have the government partner up with the government?
So, upfront and personal, this has been a very enriching and enlightening experience. And So, honestly, I mean, if you look at scaling up a system, then uh, your best option is working with a system that already exists, and the government system, the public healthcare system, however resource limited it is there right up to the last mile, and it has the mechanisms of looking after people whom we really want to reach. So working with the government has been very eye opening. It has had its downs, some challenges, and of course, bureaucracy and policies and systems that one has to work with. But I think that is part and parcel of every organization. The upside has been that there is a tremendous possibility to reach people. Imagine, how else would you set up a system that could take care of people from 14 districts in a single institution? What would it take for anyone outside that system to do it? So working within that system and collaborating. So essentially, and this is what I truly believe in, collaborating is the word, and how we can work together to take forward our goals is what is most important.
I think this is a tremendous takeaway for all those who are listening in, that you can work with the government and you can create a lot more breakthroughs, because the existing infrastructure, however it may be, can be utilized, can be augmented, can be improved, and results can be produced to work with the government, because they are providing facilities and services to the last mile. I think it's extraordinary. Coming to the issue of homeless in India, right? There are an estimated 70 million homeless people in India, and that's a huge number. And most of the people, obviously, because the conditions that they are in and the kind of uh, abject poverty that they live in, and the kind of incarceration and the criminalization of poverty and criminalization of beggary that is happening, and they get picked up by the police, and there's gangs, and there's rapes, and there's a whole lot of violence on the streets. We believe that a large population of the homeless are actually suffering from mental health issues. Are we a failed state in that sense? Because 70 million people, I mean, it's a lot of number. What do you think?
I don't think it's a straightforward, simple answer. It's a very complex mix of severe resource crunch, and this inequity is also distributed differently across the country, right? There is high inequity in states that have historically faced resource crunch. So and I think it's not, I mean, while the state has the primary responsibility to look after its citizens, looking after our people is the collective responsibility of a society.
That's true. That's absolutely true. What do you think about the anti-beggary law that is there? Do you think it should be repealed because it's causing more misery upon the people who are already poor? What is your take on that?
So I think, see, the legal framework in the country is an inherited one. It has traces of colonial inheritance, which was also true for the Mental Health Act, which has now been. We now have a new Mental Health Act in place. So similarly, we need to relook at the laws that were built in a different time for a different purpose. And we need to take a conscious call on whether they suit our needs today, and are we doing a disservice, and there are experts on, I know that there is a lot of work happening on this. So
Tasneem, there is a lot of misconception and bias about the homeless people, because a lot of the people from society who are not aware of the issues believe that they are druggies, and of course, a lot of them are into drug addiction as well. And do you think it's associated with mental health issues in some way, or the condition that they are in? Because most of them, a large part of them rather, are into drugs and do have mental health issue. Do you think there's an association there?
Okay. So essentially, bias comes from lack of familiarity, right? We don't know what happens to the life of a homeless person on the street, and we go by a small sample of what we see as the total reality, right? Now, living on the street is a very difficult and a challenging environment. Yeah, you face a lot of hardship, and you can't paint people with the so everyone who lives in the street is not a drug user. That's the first part of the story. The second thing is that living on the streets calls for a lot of coping skills that the person needs, to survive. And substance use can has been thought of as a coping mechanism for those people living in very challenging circumstances. This is not to say that using drugs is okay, but it is the repertoire that they have. It is the toolkit that they have and they draw upon. It's like surviving that environment.
So you have been serving on the State Mental Health Authority Board, and you've been a member
Right.
there. And also that you have been in this domain, you've been with Tata Trust also for 30 years, and Udaan has been around for a long time. And in fact, you were awarded way back in the mid 90s as well for your work. Tell me something, has the state of the mental health institutions or the mental health support for the people who are suffering from mental health issues at the lowest level of the society, the lowest strata of the society, is it improved at all? Do you think we are in a better position now than what we were 30 years ago? What is happening?
Oh, surely, absolutely. Just a small correction. I'm with the Tata Trust for 14 years. But yeah,
Sorry.
coming back to the question that you have raised, absolutely. Absolutely, the condition has improved. And, in the sector, we say that, finally our time has come. Finally, we as mental health professionals, and finally the whole agenda of mental health is getting center stage. It is being talked about. So there's a whole era of differences. We have a very, very progressive act in place. It's going to take a lot of effort to turn the written word into reality, but we have it. We have the written word. We have committed to providing mental health care, retaining the dignity of the individual. That's a very forward-thinking space to begin with.
I think there's a lot of stigma that is associated with mental health, even among the middle class and a large section of the society, even today, because people are loath to go to the counselor or a psychiatrist because they say, it's kanduni in the head, or pagal ho gaya hai, something like that, whatever. And although it's improved dramatically because of the awareness that is happening, because of a lot of people speaking up and a lot of awareness campaigns that are around the mental health issues, but by and large, the stigma still remains in the society, isn't it? What's your sense of it?
Oh, truly, stigma. Mental health and mental illness is heavily stigmatized, and we know that the stigma is transgenerational. So, for example, even if your nanny had a mental illness, and you were in the marriage market, you would try not to put out this fact.
Yeah,
so
I can imagine.
So yes, we have a lot of work to do on the stigma part.
So any specific measures that you think your stakeholders, your organization, Udaan, anything that is doing in terms of an overall awareness program in this space?
So the best anti-stigma campaign is effective treatment.
Yes.
And treating one individual effectively has a large ripple effect. Just imagine this. There is someone wandering the streets of a distant block in Nagpur district. Yeah, and this person gets treated and goes back to work on the farms and fields, earning a decent wage. Many villages around come to know that, quote unquote, ये तो पागल था, देखो अभी ठीक हो गया दवाई से.
Mm.
So
Correct.
there is nothing that can beat effective treatment, but we have a lot of different tools in our toolbox. And like you rightly said, mental health literacy, as we call it, is one of the biggest tools that we have. Talking to people about it, normalizing mental health and mental illness, and offering options that there is a way out. You don't need to suffer.
Great. So today is October 10th, and we're observing it as World Homeless Day because we want to sort of also bring it to the fore. We want to raise the conscience of this nation for the 70 million people on the streets. We want to get this issue out uh, in the public conscience, so that we can all address it together. Because these invisibles are somebody, they're the bunch of people who've been forgotten by the country, by the governments, and the society at large. On this homeless day, do you have any message that you would like to share pertaining to the homeless and the mental health issues? Is there anything you would like to say?
Oh, absolutely. Yeah. So I do have a few things. First is that even if they are homeless, they are part of our social environment. They are individuals from our society who have faced a difficult life circumstance. We share a responsibility in helping them have a better quality of life. And there are small ways in which you can do this. Uh, it's not just the state, but it is each of us as an individual. You can reach out and call a helpline, a mental health helpline that offers services. You can ensure that the homeless person with a mental illness in your vicinity has access to decent food, does not need to pick up food from a bin. There are so many small gestures that we can do, but bringing this issue on board, and I think you're doing an excellent job of that bringing this issue on board and talking about it, I think that's the first and most important step.
Absolutely. So thank you so much, Tasneem, for being with us. And I really admire and really inspired by people like you who have dedicated their entire lives in the service of others, especially the underprivileged. And more power to you and to people like you who are doing a wonderful job of holding this country together and holding the systems and the processes where there exists none. So thank you for being with us, and thank you for sharing your thoughts, and wish you all the best and the Udaan team all the best.
Thank you.
Thank you.